Welcome back, everyone. I'm Samantha, a team member with SM NCLEX Reviews, and today let's talk about multiple response grouping questions. This is yet another style of NextGen NCLEX questions, and be sure to check out our previous videos as we have hit so many of them to help you prepare for your upcoming NCLEX exam. At first glance, it might seem like a lot going on here with these questions, but just remember that's why you're here. So take a deep breath, take one question at a time. You can absolutely do this. Now let's go over the rundown. So basically, multiple response grouping questions are a series of select all that apply questions stacked on top of each other. So there will be various groupings or categories formatted into a table. Within each grouping, you'll select all that applies to the question at hand. Now there can be anywhere from 2 to 5 groupings. So for example, each group might be a body system and you'll select from a list of interventions or assessment findings. Within each grouping or category on the table, there will be 2 to 4 options from which you can select. The number of options will be the same within each grouping, and there will be at least one correct option in each grouping, and multiple options can be correct, and possibly all of the options given can be correct as well. So, what types of information will be in these groupings? You'll typically be given some background information, maybe some nursing notes, vital signs, etc. about your client, and then you'll be prompted to select what's an appropriate intervention, for example, from each grouping. You'll just go through each grouping and select what is correct. So just view each little group on the table as a select all that apply question standing on its own. Essentially, it's a whole bunch of select all that applies stacked into a nice little select all that applies sandwich, if you will. One great thing about the NextGen NCLEX that I know I've gotten excited about before is the possibility of getting partial credit. We love to see it. So you'll get 1 point for each correct answer, minus 1 point if you select wrong answers, but no deduction if you left out one of the correct answers. So basically add up all the correct answers, then subtract all the incorrect answers you selected, and that's your final score. The lowest possible score is a 0 on these questions, so even if you select all the wrong answers, you won't receive any negative points. Now let's look at a sample practice question from a content perspective just so you understand how these questions will work. In reality, on your exam, you might have more information about the client, like nursing notes, vital signs, or lab results. So let's jump in. We have a 23-year-old client who has been admitted to the emergency department due to an acute asthma exacerbation. Select the priority interventions from each grouping below that would be appropriate in the care of the client. Each body system may support more than one nursing intervention. So you see here on our table, we have our body systems, cardiovascular and respiratory, and then some potential nursing interventions. Go ahead and pause this video if you need a minute to read those over, and we'll go over it and talk about it. And here are your answers. So for our cardiovascular body system, the correct answers are monitor vital signs and monitor pulse oximetry. And for our respiratory body system, we have administer oxygen as prescribed, administer bronchodilators as prescribed, and assess breath sounds before, during, and after treatment. And as I mentioned before, I kept this one simple from a content perspective because these questions have a lot going on. So let's focus on our priority interventions in each body system. So our client here is experiencing an acute exacerbation, otherwise known as an asthma attack. Under our cardiovascular interventions, we definitely want to monitor vital signs as well as that pulse oximetry continuously. If the client status were to continue to decline, then continuous telemetry or an electrocardiogram might be appropriate, but initially our priority are those vitals and pulse ox. Now again, let's look at those respiratory interventions. Oxygen as prescribed, definitely. Same goes for ordered medications like those bronchodilators, think those SABAs like albuterol, or those LABAs like salmeterol. And assessing breath sounds before, during, and after a treatment. What is the thought process there? We absolutely want to hear if there's any improvement in their wheezing once we initiate that treatment. Now, a chest x-ray, what do we think about that? This wouldn't be a priority intervention at this time. And since we have 5 possible correct answer choices, the maximum points from this question would be 5. Now, you know we love to give you some bonus study information with each of these videos, so let's wrap it up with some more of that. What would you think about silent breath sounds in our client experiencing an asthma exacerbation? Is that a good sign? Their wheezing is finally gone. Are we going to celebrate that? Absolutely not. This can indicate a severe bronchospasm and impending respiratory failure, and this is a true emergency situation. Thanks again for joining me today. Hopefully you feel a bit more prepared to tackle one of these multiple response grouping questions, and you're one day closer to being the real deal. You can do this. Happy studying.